This video covers the way implicit bias and structural racism affect Child Protective Services reporting and contribute to disparities. This video addresses the nuanced decision to file a report to Child Protective Services. The 5-minute moment for racial justice is a teaching framework to promote health equity and racial justice in medical education. The framework relies on a 5-step approach that discusses the learning and clinical context, the current standard of a medical diagnostic or treatment, the historical roots and bias of that standard, contributions to health disparities, and steps to take to promote health equity. This framework offers educators a structured way to talk about this topic in a concise manner across commonly encountered clinical scenarios. By the end of this video, you'll be able to describe how racial bias leads to disparities in recognizing and reporting child maltreatment, and apply a checklist of questions to promote more deliberate, objective consideration for CPS reporting.
A 7-year-old Black female with a history of moderate persistent asthma is hospitalized for status asthmaticus. This is her third admission over the past 12 months, and she has missed several weeks of school due to her asthma symptoms. During her last hospitalization, she was prescribed a fluticasone inhaler but was unable to fill the prescription. Her family shares an apartment with another couple who smokes cigarettes. There is mold in the family's bedroom from a prior water leak. The learner physician is concerned about the patient's family and states,
"I'm worried about our patient who has uncontrolled asthma. She hasn't even gotten her last prescription of medication. Do you think we need to consider medical neglect in this case?"
This is a common scenario. How are structural racism and implicit bias affecting patient care here? These conversations are tough to have. Let's watch how 2 clinicians navigate this discussion.
This is a good opportunity for us to talk about how we approach concerns regarding medical neglect and even the complicated decision to sometimes involve Child Protective Services, otherwise known as CPS. This wasn't something that was discussed during my training, but it's important for us to talk about to provide equitable care for all our patients. So let's spend a few minutes talking about this. I'd love to hear your thoughts as well. Physicians are mandated reporters, which means that we are legally required to report observed or suspected child abuse or neglect to relevant authorities. Teachers, clergy members, police officers, and social workers are also mandated reporters. How might you decide when to file a CPS report for potential maltreatment?
I know there has to be reasonable suspicion, but having a gut feeling probably isn't enough.
You're right. It has to be paired with objective observations, signs of physical, sexual, emotional abuse, or neglect. But suspicion is subject to implicit and explicit biases, and this can perpetuate and exacerbate disparities, especially for children from minority families. What % of U.S. children would you estimate will have received a CPS investigation for maltreatment by the time they are adults?
If I had to guess, maybe 10 to 20%?
Research has shown that over 37% of all U.S. children experience a CPS investigation by the time they are 18 years old. The rate is higher for Black, American Indian, and Alaska Native children at 50%. It is a big issue that affects many families.
Wow, I had no idea that so many were affected. But why would the rates be different across races?
Families of color are not more likely to mistreat their children than white families. However, doctors are more likely to miss recognizing child abuse in babies from white families and dual-parent households. Even when there are objective findings concerning for abuse, hospitals are less likely to file CPS reports on children with white mothers and from high-income families. Bias hurts everyone.
I had no idea. Whenever I see a CPS report filed, I assume it comes from good intentions.
Bias exists even when we have good intentions in the form of implicit bias. It happens automatically and unintentionally, but affects our decisions and actions. But implicit bias alone can't entirely explain racial disparities in child maltreatment reporting. One of the highest risks for being reported for child maltreatment is poverty. Poverty is a risk factor that interferes with a parent's ability to care for their children. It restricts access to basic needs, housing, food, medical care, and the stress of this can affect parenting capacity. Children from low-income families are overrepresented in the child welfare system, and there is a strong link between poverty, being from a racial minority background, and CPS involvement.
Why might that be the case?
In the 1940s and 50s, there was a policy called redlining that denied mortgages to Black individuals based on where they lived. The government outlined these neighborhoods in red that mostly had Black residents and deemed them too risky to invest in. This limited Black families from receiving mortgages, building home equity, and generational wealth. As a result, Black families were forced to stay in these high-poverty neighborhoods. Black children are also 3 times more likely than white children to live in poverty. These areas also have higher rates of police or social services surveillance. This results in families interacting more frequently with mandated reporters, which contributes to higher rates of CPS reporting. Abuse and neglect are more commonly reported in low-income families of color, and studies have shown that many of these cases are not substantiated.
I had no idea of the effects of redlining on poverty and CPS reporting. What's the end result for the children?
This has led to an increasing number of low-income children of color, especially Black and American Indian or Alaska Native children, being removed from their homes and sometimes inadvertently placed in unsafe homes within the foster care system.
So, how can we be more objective when considering medical neglect or CPS involvement?
CPS is an important resource that can help families. In the end, we all want to protect the child, but when considering a mandated report for suspected child maltreatment, ask the following questions to promote a more deliberate, intentional consideration of the case. Firstly, what are the specific concerns of actual harm to the child? Secondly, is there objective data to support this concern? Third, are there social determinants of health that may influence how the family interacts with the healthcare system? And as healthcare providers, how can we help mitigate these factors? And finally, how do identities, power, privilege, and bias affect this case? So bringing this back to our patient, what do you want to do instead?
From our discussion, what I learned is implicit racial bias may contribute to under-recognition of child maltreatment. Poverty is a risk factor for child maltreatment, and historically racist policies, such as redlining, have contributed to racial wealth disparities. Consider using a checklist that takes into account how social determinants of health affect healthcare access when considering to file a CPS report. I recommend we ask the family a bit more about what's going on at home and work and see if our team or social worker can provide any resources.
I agree. Let's go see them together.
To learn more about the 5-Minute Moment for Racial Justice and other health equity resources, visit 5mmracialjustice.stanford.edu.